Continuing on in my series from The Courage to Heal on pushing back against the false memory syndrome concept, the part that I'm at now is basically going over reasons why that narrative is nonsense, at least the vast majority of the time. Being an incest survivor does not offer enough advantages to encourage anyone to jump on the bandwagon. It said as incest survivor, I would argue any kind of CSA survivor. Those who seek to invalidate survivors like to claim that incest has become an attractive club to join, and that people claim to be survivors in order to get attention, sympathy, approval from therapists, or to create an excuse for their contemporary problems. In reality, survivors usually minimize the abuse they experienced or pretend it didn't happen, rather than make up or exaggerate histories of abuse. It's excruciating to know that people you loved and trusted could have betrayed you in such a profound way. Most survivors are not eager to name their abuse. On the contrary, they avoid facing the rigors of the healing process for as long as they can. As Judith Herman and Mary Harvey point out, recovering memories is so agonizing that survivors hold on to their denial for as long as possible. When traumatic memories break into awareness, distress can be overwhelming. Survivors tend to cling to their doubts long past the point where the most impartial observers would be convinced. That is why many therapists and self-help books encourage survivors to have confidence in their suspicions. In fact, as psychologist Christine Cordes points out, many survivors who do remember childhood abuse wish that they didn't. Those with access to memory usually wish to forget, repress, or minimize what they know. Those with absent, hazy, or fragmented memory are usually desperate to remember until the memory returns. Then they move to the position of survivors with memory. They want to forget. Identifying as an incest survivor confers very few privileges. It does name a reason for an often complex and dizzying array of problems, but naming the root cause as abuse is only the beginning of the healing process. The responsibility for healing inevitably lies with the survivor. No one else can accomplish the arduous work of healing, feeling the feelings, and making the changes needed to create a healthy life in the present. Although healing is ultimately rewarding and worth the work, it is not something one would choose if it weren't absolutely necessary. The propagation of the false memory theory reinforces some very old and powerful stereotypes about gender, class, and race. The first stereotype is that of women as pawns. Weak, gullible, and so impressionable that reading a book about sexual abuse or having a therapist suggest that they might have been sexually abused would be enough to convince them of a reality that was not their own. This stereotype is not only false, it's a gross insult to women, telling us we don't have the power or sense to know what happened to us. We do not believe most women are so easily led or manipulated. Supporters of the backlash frequently talk about child sex abuse hysteria. In Freud's time, hysteria was a legitimate term used to describe a condition of severe emotional and mental distress. The word has since acquired such negative implications and has been applied to women in such insulting ways that we suggest it's long past time when hysterical can be responsibly used to describe women's testimony. Clearly, supporters of the backlash have chosen this word for its inflammatory effect. Another erroneous stereotype is that abuse doesn't happen in affluent white families. According to a fact sheet put out by the False Memory Syndrome Foundation in June of 1992, the median income level of parents who join their organization is over $60,000. More than half are college educated, and 25% have advanced degrees. In one newsletter, founder Pamela Frade responded to charges that her group might be harboring abusers. How do we know we are not representing PDFs? This question keeps coming up, and it is critically important to our image and to our ability to get things done. One person suggested that I take a camera to meetings so that when the opportunity for going public presented itself, we could suggest representatives who have the best image. If I had taken a camera to the 3 meetings held here in Philadelphia, I would have been hard put to know whom to photograph. We are a good-looking bunch of people. Graying hair, well-dressed, healthy, smiling. The similarity of stories is astounding, so script-like and formulaic that doubts dissolve after chats with a few families. Just about every person who has attended is someone you would likely find interesting and want to count as a friend. The implication is that well-to-do, good-looking people couldn't possibly have abused their children. This contradicts well-established facts about abusers. Although they aren't always identified as such, the families presented in the media as victims of false memory syndrome have all been white. This message here is that real abuse takes place in poor families, in African American, Latino, Asian, and Native American families, but that false memories are to blame for the disintegration of well-to-do white families. This implication is both racist and false. Abuse crosses all lines of race, class, and gender. It is unusual for therapists to convince their client that abuse took place when it didn't. The core of false memory argument is that fictitious memories of CSA are implanted in the minds of impressionable patients by an overeager, manipulative, or greedy therapist, and that they use coercive mind control techniques to do so. This is not how responsible therapists work. The foundation of good therapy is a respectful relationship in which the therapist provides a safe space, genuine caring, and support. Good therapists don't lead, they follow their clients into the difficult and painful places they need to go. In doing so, their clients are empowered to do their own healing work, to uncover their own truth, to find their own truth. This is not to say that there aren't bad or even abusive therapists. Unethical therapists have forced hospitalizations, over-medicated their patients, had sex with patients, and perpetrated a variety of other abuses. But such practitioners are not representative of the mental health profession as a whole. All therapists, even good ones, do sometimes make mistakes. In the past, these mistakes, at least those relative to survivors, had more to do with minimizing and denying abuse than seeing it where it didn't exist. Even now, many therapists are reluctant to explore a history of abuse with their clients. As awareness of sexual abuse has become more widespread, however, therapists sometimes have made the opposite mistake, concluding that a client was abused before that person had a chance to explore this possibility herself. But even then, it is very unusual for clients to take on every suggestion a therapist makes. When a therapist inaccurately surmises that someone has been sexually abused as a child, it is a serious error of grave concern. It has the potential to damage both the client and the family involved. Families who suffered this kind of pain deserve acknowledgement and compassion. Women who say they were misled in therapy and that the abuse they once claimed never really happened call themselves recanters. A number of these women report being mistreated through hospitalization, excessive and inappropriate drugs, and authoritarian and invasive methods that far exceeded simply asking the question, "Were you ever sexually abused as a child?" Or even more leading, You show all the signs of being sexually abused. I think you were." Recanters have described not just being asked if they were abused, but feeling coerced by their therapist into coming up with a story of abuse. Some report that they made up a story, either to please their therapist or to fit in with members of their group. Only later, as time went by, did they begin to believe these stories themselves. Obviously, my experience is just mine, but I can't imagine a therapist saying, "I think you were sexually abused." Like, that seems wild to me. I don't think the vast majority of therapists would ever say that. Or even that you meet all the criteria of somebody who was abused. Like, that's too leading to me. But yeah, where that has happened, I definitely think that's a huge misstep on a therapist's part, personally. Anyway, back to the book. Some recanters talk about being subjected to mind control and feel as if they're recovering from being involved in a cult. Interestingly, a sizable number of recanters say they were involved in cults or cult-like groups at an earlier time in their lives. An article in a newsletter for recanters explored this common link in the histories of many of its readers. It says, "We often share the same vulnerabilities of high idealism, dependency weaknesses, basic resistance to change, and spiritual hunger. A cult experience offers us a tempting escape from the hostile pain of the real world, a black and white answer, a righteous us against them stance. There was a desperate inner structure to be gained from our idealistic battle against perceived perpetrators and abusers. This experience of these women is painful and must be acknowledged. However, it does not hold true for the majority of people who recover memories of CSA during therapy." In the July 1993 newsletter, the False Memory Syndrome Foundation reported that there were 60 women who said that the sexual abuse they initially described never took place. Even if all 60 cases were accurate, they represent only a tiny fraction of the millions of actual survivors of childhood sexual abuse. Confronting one's abuser and family is one of the most painful, frightening things a survivor faces. As with children's disclosures, it is possible that some recantations are a result of enormous family pressures rather than an erroneous accusation. It is also of interest that a number of recanters acknowledge that they were sexually abused. What they now say is that their accusations snowballed beyond truth, implicating people who did not actually abuse them. There need be no schism between survivors and recanters. It is imperative that recanters speak out and tell their stories, but it is equally important they do so without attacking all survivors of CSA, the validity of their memories, and important social gains that have been made. Therapy is rarely the sole or primary trigger for memories of child sexual abuse. Proponents of the false memory syndrome promote the belief that most adult survivors regain their memories of CSA at the instigation of a therapist. This is not true. Many survivors never see a therapist at all. They struggle along as best they can, coming to terms with the abuse, or they work through their pain without the aid of a counselor. Of those who do seek therapy, many already know about the abuse. Either they've always remembered it and they now are ready to seek help, or something else triggered the memories and they need help coping with the fallout. There are 3 factors that usually present when adults or adolescents recall abuse that they have previously blocked out. 1 is distance from the original abuse. 2 is a life circumstance that leads to the letting down of normal defenses. And 3, an external event that re-stimulates the memory. These factors can exist in a good therapeutic relationship, and therefore some survivors do uncover abuse while in therapy, but recall of child sexual abuse is far more common in other circumstances. Life transitions such as puberty, childbirth, a commitment to an intimate relationship, the death of a parent, retirement, moving, menopause, aging, divorce, losses of any kind, frequently trigger memories. So does sobriety. Medical treatment, a trip to the dentist, an exam by a gynecologist or urologist, surgery, or other invasive medical procedures can also jar loose, buried feelings and images. Adult experiences of victimization, a rape, a robbery, being fired from a job often stir up memories of earlier violations. Parents sometimes remember their own abuse when their child is abused, or when their own child reaches the age that they were when they were first abused. Survivors may also remember while making love, exercising, or getting massaged when they use their body in a new way. Of course, any of these life events may occur while a survivor is in therapy, and a survivor may seek therapy for help in coping with such events, but a therapist's question or even suggestion about sexual abuse is rarely the only or the most significant reason for memories to emerge. There is a lot more to determining whether someone is a survivor than a single memory. The false memory argument hinges on the assumption that an assessment of a child's sexual abuse is based solely or primarily on memory, but that isn't true. Long-term trauma is reflected in the daily lives of many survivors. For some, the injury is obvious. They have suffered from severe and debilitating symptoms for many years. Some have permanent physical damage that is unmistakably traumatic in origin. Other survivors have been successful at creating high-functional lives, but their inner world is self-hating or full of pain. These effects, which have frequently been present for years prior to uncovering a sexual abuse history, are not created in a therapist's office. Reconstructing a history of child sexual abuse is a complex process based on a whole constellation of symptoms, which memory are just one part. Phobias, flashbacks, intrusive imagery, chronic patterns of denial and dissociation, flooding of feelings, spontaneous regression, startle reflexes, numbness in the body, and terror of sex may all point to a history of trauma in childhood. Those who say memories of sexual abuse can be implanted fail to explain the presence of these symptoms. A therapist cannot induce you to jump out of your skin anytime someone comes up behind you. False memories cannot explain why you see your abuser's face when you climax, why you're terrified of subway cars, why you carve into your body, or why you wake up terrified every morning at exactly 4:00 a.m. These and hundreds of other distressing patterns fall through the cracks of the false memory theory and are, unfortunately, often explained by an all too real history of child sexual abuse. More to come in yet another part, so follow me if you don't want to miss it.